Hello everyone, my name of course is Artimage and welcome to day 9 of VEDA. Now 2 days ago, the article went live about my friend Kristen, who I was alluding to on the first day of VEDA in regards to her circumstances during this pandemic. I don't feel the article did a very good job of representing her situation adequately, so we're going to give her the chance to speak about that directly herself. So we're going to go ahead and switch on over and see the interview that I've just done with her. Hello everyone, thanks for joining us. Joining me today on the vlog is Kristen Williams, who is featured in the CBC article you can find down in the description below about her struggles during the recent COVID-19 crisis. Kristen, thanks so much for joining.
Thanks for having me.
All right. So, what was the impression you got from the article?
That it was pretty biased towards the agency, actually. Unfortunately, it was not the outcome that I was hoping for, because I had spoken to the reporter at length about my situation, and I was hoping for her to really convey that and convey the serious risk that myself and all the other people that are with the agency, VHA, are facing, and that didn't come through at all. So.
Yeah, I definitely myself got a sense of they were just trying to do this as a puff piece, saying, look at this brave person trying to maintain their distance from the people that work with her as well as the general community to try and stop the spread. Now, do you feel that they represented your situation at all accurately?
I mean, the facts are there, but really what is not there is the dire situation itself. So it's missing the element of this is something that's born out of desperation. I'm not refusing care because I want to or because I think I'm exceptionally strong. It's quite the opposite. I'm refusing care because I cannot expose myself to that level of risk, and I have the ability and privilege to do so. It has nothing to do with strength, and that really doesn't come through in the article. What comes through is that I've made a choice to refuse care, which is not accurate. I feel at this point I'm refusing care out of necessity to protect myself and to protect others.
So the CBC article did mention the agency, VHA Home Healthcare, was taking measures of screening employees who had returned from travel or been in contact possibly with those that had returned from travel to try and reduce the spread amongst its employees and the people that they see to. Do you feel that this is adequate measures?
No, especially given all the science, right? We know that I think it's something like 50% of people are asymptomatic, so they have they've contracted COVID and they don't show symptoms. And knowing that information, we need to put a lot more measures into place, whether it be really reducing client to staff exposure, or ultimately having personal protective equipment available for all staff, because the rate of contagion that this virus has, you can't risk waiting for someone to show symptoms. It's illogical, and frankly it's negligent to wait for that. So no, I think there needs to be a lot more measures put in place.
Now, you and I have been in contact about this directly. You were the subject of my April 1st VEDA video to some extent, trying to provide a little cover there, at least until this article went live. You said that the staff is choosing, or the agency is choosing only to give staff PPE once they're showing symptoms, correct?
Yes.
And if they want anything more, like the clients who are seen to want anything more, they have to provide it themselves.
Yes.
And what kind of a burden do you feel this places on yourself and the PSWs who come and do this work?
A pretty impossible one, to be honest. Everyone knows, or should know by now, that there's a huge shortage of gloves and masks available to the general public. And so knowing that the agency doesn't have that equipment on hand is upsetting, to say the least. It makes all of us feel unsafe because most of us don't have access to those resources. And you would assume that an agency that services the vulnerable sector would have access to those resources. There are other agencies in the city that I know provide different types of care that do have access to PPE equipment, and knowing that is also upsetting in a different way, right? Because you know that some agencies have thought about it and have planned for in the instance of a pandemic like we're seeing now, and VHA is not one of those agencies. So it's really upsetting. It is a burden that a lot of us just can't bear. Like, I don't have any particular specific access to gloves or masks, because why would I? I'm in the same race to get them as everybody else is, and I think that's deeply problematic, especially because, if I was still having care, I would need to see an attendant 3 times a day, and if I wasn't able to provide the PPE, I wouldn't feel comfortable because I'd be exposing myself and them. So it puts us in a really bad situation, to say the least.
Now, is there any details you feel that the article completely glossed over or cut out that you had discussed before that you want to make sure gets out to the public?
The thing that I think people need to most understand is, with this level of contagion going around, you cannot risk agencies like this one where there are multiple people with disabilities housed. Specifically in my building, for example, VHA, there's 15 different people on the service, I believe, and that means that 15 different clients are at risk, and all the attendants that work with us are also being put at risk. And if one of us gets infected, all of us immediately or seemingly immediately will get infected. So there's no like, oops, you're infected, you should go home and isolate. What it means with this level of personal care is that as soon as someone is infected, everyone is. And then we're going to have an outbreak here. And VHA services 7 buildings in Ottawa, meaning that they are currently, with their negligence, kind of hoping to slide under the radar, and just hoping that no one gets infected. But each of those 7 different buildings are like a prime spot for an outbreak. And once disabled people end up with an outbreak on our hands, well, most of us are going to need the hospital, and some of us will die. Like, that's inevitable given the severity of our disabilities. You don't live in a place like this unless you need pretty intimate personal care, right? So if you ignore all those factors, it's nothing short of negligence, which is what I keep going back to. I think if people really want to avoid future outbreaks within the community, they need to start by looking at people with disabilities.
And you have mentioned how many of the PSWs do have to take public transit to get about between the facilities they service, correct?
Yes, that is.
Right, so obviously we have many vectors here for the potential for this to spread within the disabled community within Ottawa.
Yep.
All right, Kristen, thanks so much for your time.
Thanks for having me.